Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Sometimes during infertility treatment, the procedure is postponed for another month because of presence of fluid in the endometrial cavity, that is inside the uterus, in the innermost lining of the uterus. What is this endometrial fluid and why are we postponing your treatment in presence of this fluid? Let's find out today. Endometrial fluid is a natural secretion that occurs within the endometrial cavity of the uterus. It is also known as uterine fluid or intrauterine fluid. The endometrial fluid is produced by the glands of the endometrial lining, which is a tissue that lines the inside of the uterus. The amount of endometrial fluid present in the uterus varies throughout the menstrual cycle and it is influenced by hormonal changes. During the menstrual cycle, the level of estrogen in the body rises, which causes the endometrial lining to thicken and produce more fluid. This fluid is necessary to provide suitable environment for a fertilized egg to implant and develop. But in some cases, an excessive amount of endometrial fluid can accumulate in the uterus, which is called as endometrial fluid accumulation or hydrometria. This condition can be caused by hormonal imbalances, uterine infections, or other medical conditions. And if you have concerns about endometrial fluid or experiencing some symptoms such as abnormal vaginal bleeding or pelvic pain, it is important to consult with your fertility specialist who is treating you for either ovulation induction and timed intercourse, that is to try on your own that month, or it is for IUI, intrauterine insemination, or an embryo transfer during an IVF procedure. They will conduct a proper evaluation and then appropriate management will be provided, because treatment for endometrial fluid depends on the underlying cause of the condition. In some cases, endometrial fluid may not require any specific treatment. It may be a normal variation in the menstrual cycle, but if endometrial fluid accumulates and it is causing symptoms or complications, then treatment may be necessary. If this fluid in the endometrium is accumulated is due to the hormonal imbalances, hormonal therapy may be recommended. And this therapy can help regulate the menstrual cycle and reduce the amount of fluid produced by the endometrial lining. This may involve the use of birth control pills, progesterone therapy, or other hormonal medications. In cases where endometrial fluid accumulation is due to an infection, antibiotics may also be prescribed to clear the infection and reduce inflammation. If there is an underlying medical condition causing the accumulation of endometrial fluid, such as fibroids or polyps, surgery may also be necessary to remove these growths. But it's very important to consult with your fertility specialist gynecologist when you're experiencing abnormal vaginal bleeding, pelvic pain, or other symptoms related to this endometrial fluid accumulation. They can provide the right kind of treatment based on your evaluation and of course your individual needs and medical history. If you want to understand more about this, please feel free to contact us at ZIVA Fertility. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.